Well, Marie has been an asset to the National Catholic Bioethics Center in more ways than we can count.
So she's a person with a great number of gifts, and we have profited handsomely from her many years of faithful service here.
She has such a breadth of knowledge and experience. She's been a great blessing. And both her and Father Tad, they've been critical to the work of the National Catholic Bioethics Center. And thank goodness we have the National Catholic Bioethics Center.
She brings an amazingly wide background that has really served the work of the center. I mean, she was a nurse. She was a nursing administrator and leader in the military.
And she's also a retired military colonel, received the Meritorious Service Medal as well for her work, so quite distinguished.
She's constantly educating herself and in the process educating all of us. Her degree in canon law is indispensable in the work that we do and the work for the church.
She has done a lot of work in public policy. That's where she works for us today primarily. She's now in Washington, D.C. and does public policy work for us.
I can't even list all the other accolades and accomplishments of Dr. Hilliard, but I can say she was a great inspiration for me and part of my own formation as an ethicist.
In the midst of some of our complicated ethical decisions and discussions, she tends to bring an angle that the rest of us may not have articulated clearly, or maybe not even thought through quite as clearly as we should have.
A lot of times, the people that really provide direct care are nurses. And so it's so important that they understand also the ethical issues that are involved with the care of their patients.
I think the word that first comes to mind when I think of Marie is giving. She's a tremendously giving person.
Marie is very knowledgeable and she's a good nurse. I'm very fortunate to have Marie for a friend.
Well, I use one word, is love. It's just the way she approaches everybody. There's no stranger in her sight.
We are to see Christ in everyone we care for. And sometimes it's not easy. I remember working in a VA and this person was so sick and so much at the end of life and so many wounds. And I remember looking at him and thinking, Philip, this is Jesus.